are you?
All good. So, am I audible? All clear?
All clear. What about me? Visibility and
All,
audibility?
all, both all clear. So,
Amazing.
guys, firstly, welcome to the 42 episode of Dr. Patisi's show. And this is a very special week, and this is at least my first live here on YouTube. And I'm really grateful that I'm having it with Dr. Vidhi Bhanushali. So, let me introduce you, ma'am, first. A very good evening and welcome here.
Thank you so much. I'm equally glad to have this wonderful conversation around women and dentistry and entrepreneurship.
Right,
Just looking forward.
right. So, guys, Dr. Vidhi Bhanushali is the co-founder of the and the chief dental surgeon at Dental Dost. So, Dental Dost is an Indian company, and we will be talking more in detail about that. And she is a recipient of Pierre Forger International Merit Award. I hope I'm pronouncing it right,
Yes.
and a holistic dentist who believes that everyone, no matter which area they live in or they can afford it or not, everyone who has teeth deserves a good health care. And I have personally seen ma'am's post where she speaks to various dental colleges, various dental students, addressing the fraternity about the dental services and innovations. She is a keen researcher and has published various papers about like recent advances that is happening in dentistry. A very welcome, ma'am, and we have a lot to discuss.
Absolutely. Looking forward. Thank you so much for a wonderful introduction. I'm
Thank
sure
you.
the guest, the listeners right now, and even the ones who will be seeing the recorded version later, will
Right.
at least take away two to three key messages after this conversation.
Right. So, a very happy Women's Day, firstly. I know it's the week. So, ma'am, honestly, I have observed this. I really have gone through this. The toppers of my batch,
Hmm.
the photos that are hung in the dental colleges, most of them girls, now either are married, either have children, or either have done MTS, or that's it. Or either practicing in the dental colleges, or very few out of if 100 students I say, and if even half of them are women or girls, hardly one or two have opened their dental practices. So why this ratio? I'm not able to understand.
This is something we were just speaking yesterday in one of the technology colleges where we had this amazing panel again on the same topic. And see, I think the percentage of women who have started their own practices have gone up lately. That's not a problem. I think the main problem lies at the management level or the decision makers who are at the council level or at the association level, right?
Okay.
So again, what we commonly see, right? Uh, Total girls raised to boys ratio in a dental college is 70 to 30
Right.
typically.
Right.
uh, this is throughout an undergraduation and post graduation. Later, when it comes to even applying for jobs, we see a lot of female dental surgeons coming out and doing exceptionally well at their practice. I have also seen a lot of them doing research and opting for out of the box avenues. To
Yeah.
cite one example from our own database that we have of dental surgeons, we have an upcoming first of its kind program in entire Asia or globally,
Right.
which is the Impact program.
Yeah.
The ratio of applications that we've got is again 60 to 40, where 60% are women dentists.
Okay.
Uh, so, going in an uncharted territory, trying out something new, and taking risk is not unfamiliar for women surgeons, dental surgeons. But there is some problem when it comes to boasting about your achievements and climbing that ladder, having that willingness to go at management and then decision making level, and then driving the change, because we need more such women leaders in
Right.
dentistry as well,
Right.
to whom the young surgeons can look up to.
Yeah.
Yeah.
Like you.
Yeah. No, like you, like anybody, and I'm very incredible work with your YouTube channel. And before this
Thank
live, I
you.
was just going through the various topics and the kind of views and comments that we have. So many young doctors are typing that, can you do a video on this topic, on
Yeah.
that topic? And a lot of videos on career avenues had the maximum views and comments. So
Right.
definitely, we need people coming out here and speaking. And it's not easy, right? Doing this every single day. But this is how
Right.
it will create a ripple effect, and we shall make an
Exactly.
impact. Yeah.
Exactly. And on the back end, if we speak about the YouTube or something like this that we are doing, other than the business part, it has nothing to do with us. Like, of course, the monetization, etc., is there, but it's like there is no such benefit that we are getting by doing this. But it's like the passion might be that we have, or something we want to see that change in dentistry in India. So that is why we are doing it.
Yeah, I think the more we talk, the more content is created around the same. That's the first level
Exactly.
of requirement. Uh, Again, in business, right? You start anything, you take advice of the entrepreneur who's already started it, or any agency. They will start with your content creation first. It could
Yeah.
be in the form of blogs, which was earlier the style. Now it has all shifted to short videos, right?
Right.
Long videos, the reels format, shorts format, whatever. But content is very necessary, important.
Right. So, ma'am, you mentioned the impact program. Let me tell you guys, the impact program is firstly the non-clinical profile. It is basically for the dental interns and basically for the freshers. So, let me please, ma'am, share like what exactly is this program all about?
So honestly, I was just uh, going through all the applicants that we get, uh, who apply for a job, right? It could be either part time, full time, remote, in office, doesn't matter. But one thing which was common in all these applications was missing the important skills which are required to take that job, because
Got
in
it.
4 plus 1 year that we have in our BDS and 3 years, we are taught in and out about the clinical practice, the most recent technique which is available for clinical practice. Also, to a certain extent, soft skills are covered. I would not say
Yeah.
that we are covering it in dental curriculum fully, but again, the other aspects of non-clinical nobody is touching, because the concept of non-clinical practice where we are applying our clinical skills. Let me tell you that,
Right.
right? Not something where you are just analyzing data or just studying some other medical or pharmacovigilance sort of things. You are applying your clinical skills, what you've learned for 5 to 8 years, and delivering it in a non-clinical setting where you're just remote from patient. Then
Okay.
it could be either your teleconsultation, your video consultation, data annotation, data analysis, etc. is
Right.
nowhere covered, because again COVID got that change, right?
Yeah.
First thing. Second, when it comes to managing finances, understanding economics, hardly a chapter or two in our public health dentistry, again, which nobody took it seriously.
Right.
So that was the first trigger point which made me think that if I want to make all these applicants qualified, not just to be able to work at dental those, but any other company, now we know a lot of startups are emerging.
Yeah.
They should have the right skill set, and they need mentorship and training for that.
Right.
Second thing, when we had placed first of our first kiosk at a dental hospital, uh, it was a national conference hosted by IDA, and
Okay.
students were coming to me and asking, "Can you please guide us at the skill set which are required? Where do we go for training?"
Right.
Because just 1 2 day workshop won't help.
Yeah.
And it saddens me. You won't believe, doctor. Few of the applications what I had studied, they have done their BDS, they've done MDS, they've also done PhD research, and
Right.
now they've written that we are learning Python, we are learning Node.js, we are learning Java,
Right.
and I reply to them, come on, you are dental surgeons, you have so much of experience. Why are you learning computer languages? The
Right.
reply that I got from that is so that we are eligible for non-clinical role, or we can do something in artificial intelligence
Yeah.
sector.
Yeah.
And I was like, you need not learn computer languages. We have engineers for that.
Yeah. Yeah. Exactly.
So that validated that, not just the direction, but a proper mentorship, a proper program is required, and
Right.
that led us to start the Impact program, which is a 2 month, 4 and 4 8 weekends long training
Okay.
program given by us industry experts, where you will be exposed to everything that you need to know,
Okay,
right?
ma'am, it is digital or it's like happening somewhere?
So it's an
It's
online
in
program.
digital. Okay, okay,
Yeah,
perfect.
yeah.
Okay. So, ma'am, coming to dental dose, firstly, I want to, ma'am, which batch of admission of BDS you are?
So this is in 2013.
Okay.
Yeah,
And, matlab, like, you got admission in 2013.
correct.
Okay. And you are like from which college?
So, School of Dental Sciences, Karad. This is in
Okay.
Maharashtra. Yeah.
Right. And you did MDS?
No, I didn't go for MDS. I was
Oh,
getting a seat,
finally.
but I was very focused that, I don't want to invest 3 more years in MDS. Yeah.
I understand, completely understand. So, how you came up with dental dose? Like, idea kahan se aaya and how you proceeded with that?
Right from my second, third year, I had some background of technology due to my
Okay.
and I
Okay.
understood that tech needs to be as a base, as an enabler for us to spread that message of oral health and its importance. Because when we see dentistry in general in India, we know the kind of prevalence rate that we have, right? More than 85% of patients have oral diseases, yet only
Right.
12% are visiting a dental surgeon. Then I
Right.
studied the statistics of dental surgeons that we have. The
Right.
ratio that we have in our country is more number of dentists than required. So then
Exactly.
we have problems. We have great dental surgeons, but why aren't these patients coming to dentist for treatment? And then the list of things, right from lack of education, lack of awareness, all the information is superficially available. Nobody is talking in depth about every process.
Right.
So that was the beginning starting point. Second was the kind of oral cancer patients that I have seen, and the kind of surgeries that we've done, right? Uh,
Yeah.
it's very saddening to see that they come to us at a very late stage, and this could have been avoided, prevented, right? If they were at stage one and stage two, we could have given a good quality of years to them.
Sure.
But again, same attitude, right? जब तक pain नहीं होता है, दर्द नहीं होता है, why think about it?
Right.
And third thing was statistics of the survey, which is very shocking, that more number of people have phone connected to internet, but they don't have a
Yeah.
toothbrush. So I was like, when
Right.
they have
Right.
a phone and they
I
have
read that.
internet, and then we can reach to them, then we can definitely make an impact. So
Right.
these three combined factors were the starting point. Yeah.
So, for the people who don't know, what exactly is dental dose? Like to the investors, we pitch an idea, वो एक line में बोलना होता है. So, for understanding, like in one line, what exactly is dental dose?
In one line, very simple, dental dose is a dentist in your pocket.
Okay, got it.
Simple, right? We have converted your smartphone into an AI dentist.
Right,
Now, these days, because of our G20 presidency and startups, people have a fair idea of what artificial intelligence is.
right,
So, we have trained our model to think and diagnose and give treatment plans just like a dental surgeon, and
right,
not just limiting to that. Now, if you have a family dentist, for example,
right,
he won't be able to manually take updates from every patient that he has.
right.
Now imagine the patient base if he has more than 5,000 patients. कितने
Yeah,
लोगों का वो हर बार हैबिट्स चेक करेगा, हर बार उनको टाइमली रिमाइंडर जाएगा, right?
right.
But through the app, it is as simple as you click 3 photos of your mouth,
Okay,
front, upper, and lower. You get
okay,
instant diagnosis within 10 seconds,
okay,
10 even maximum. एंड
okay.
आगे फिर आपको कौन से हैबिट फॉलो करने हैं, आपका ओरल टाइप क्या है, व्हाट रूटीन शुड बी डन, व्हाट फूड यू शुड ईट नॉट ईट, एंड मोस्ट इम्पोर्टेंटली व्हाट प्रोडक्ट्स यू शुड बी यूजिंग फॉर योर ओरल,
Right,
आई
right.
रिकमेंडेड टू द पेशेंट्स.
So, आपका जो business है dental dose, is it B2B, that is for guys, business to business, or it is D2C, like direct to customers?
So see, D2C is a commonly used words where we are a product company selling some products to direct consumer.
Okay,
Here, this is a B2C to B, where
okay,
we have consumer first. They've
right,
understood about their oral health.
right,
Then they have also understood if there is any treatment required in a clinical setup, we would
right.
send them to our partner clinic.
Clinic, of course, got it.
Otherwise, if the score is good or only just minor tweaks are to be done
Right,
in oral hygiene routine and the
right,
products,
right.
uh, they can just be connected to the app, and their score will increase and
Yeah.
oral hygiene will be monitored.
Okay, got it. So, when you formed this company, which year?
This we started in the company was incorporated in August 2020, but
Okay.
the research work started way back in October 2018.
Right, right, of course. And so is it like I'm guessing your other co-founder is your husband?
Correct.
Right. So he is into management.
So he is the one who has designed the entire tech architecture.
Okay, got
So
it.
he's the tech guy between us
Yeah.
and the medical person.
Right, right. And this is like a partnership company?
It's a private limited company.
It's a private limited company. So guys, there are different types or entities of companies. Like majorly 7 या 8 होते हैं. वैसे तो बहुत सारे हैं, but major 7 or 8 होते हैं. Like partnership, private limited, proprietorship. ऐसे बहुत सारे हैं. So just for the info. And like what challenges did you face since you launched till now, and how you overcame that?
That's a very long list. But seriously, in a journey of startup, you have few moments of glory, a few
Of
moments
course,
of triumph,
of
a
course.
long haul of uh, uh, dis- disappointments, of struggles, of challenges. But right from the time that we started, first thing first was, since it's an artificial intelligence led diagnosis,
Exactly.
for any training of module in you need data.
Right.
Data needs not to be just random. It needs to
Yeah.
be in certain format, and then you have to do various steps of augmentation and segmentation, and then training of it. And you know that if we want to train a model to detect oral diseases, we need dental surgeons to train them.
Exactly.
So my God, that was like an impossible task which we thought back then. But I was
Right.
like, we need to take the first step, and then we will
Right.
figure out how do we go. Although we had a tentative timeline, but
Yeah.
right from collecting the data in a format that we needed,
Right.
second, then forming a strong team of dental surgeons who are trained to annotate this. And
Right.
you know the kind of technical problems medical or dental fraternity has.
Right.
Right? Third thing was, once uh, it was ready, which was again a long period of 1.5 years that we were trying multiple models to convince our fraternity, dentist, to believe that okay, this is working. You know,
Yeah.
uh, this is helping patients to generate uh, more curiosity, motivate them, and then get them to dental clinic for treatment if required.
Yeah.
It was super difficult to convince dental surgeons. Me being a dental
I
surgeon,
understand.
but then COVID happened and things changed.
Right.
Uh, Fourth, even for consumer. Now,
Yeah.
for a customer, when he's calling some other specialty, he can describe. See,
Yeah.
if my head is aching from here to here, this is the portion. But here, the consumer is not able to describe his oral problems. उनको पता
Right.
ही नहीं कि दांत में ऊपर दर्द हो रहा है नीचे हो रहा है because we have the radiating pain, right? वो गम
Yeah.
में पेन हो रहा है जीभ में पेन हो रहा है, no idea.
Yeah.
So we had to make our own protocol and system for teleconsultation because no precursor there.
Right.
And then these are the first level of challenges. Next
Yeah.
was to find the right advisors and investors, because
Right.
health tech, especially in deep tech, our
Right.
market is still not so mature
Yeah.
to understand and bet on innovative ideas.
Exactly.
Yeah.
तो
So,
आपने खुद से if you are okay to share like an approx amount आपने खुद से कितना इन्वेस्ट किया है and from the investors आपने कितना लिया है? Have you got the funding?
we have got the
The
initial angel funding.
right,
Yeah.
right.
And
Okay,
we are looking forward to pre-series when the right time comes.
okay. Yeah.
Yeah.
And
So
like you have by yourself has put up any money?
a lot of, yeah, we should, because see, earlier, this is 7 to 8 years back. Sometimes you used to get invested just by your presenting ideas. But things have changed lately in startup
Yeah.
ecosystem, where you
Yeah.
need to have your skin in the game. You need to first bootstrap, uh,
Right,
right? And
right.
once you have validated your product market fit, you have the right
Yeah.
MVP, whatever stage, because it really differs from industry to industry. Only
Exactly.
then the investor would like to put in their money, and then the trust is established.
Right.
So we put together, we have put more than 85 to 90 lakh rupees. Uh,
Okay.
yeah. And
Like
then
this
the
is by yourself, like by your own savings or
That's
family relatives, etc. And then you of course got the extra like the investment from the
right.
investors. Okay, perfect. So your team right now is like started with two, which I can clearly understand. So now is it how big the team is?
So now total number of members that we have is 24 people.
Oh wow, okay,
Yeah, yeah. So out of which majority of them are dental surgeons, obviously,
okay,
right? And then we
perfect.
have a strong team of tech, and again a small team of the sales and marketing.
Right, of course. So your, which I can understand the revenue model, if I am understanding, is first the partner clinic. Second
Yeah,
is the impact program can one of them. Third is the products. Suppose if my oral hygiene out of 10 is 9. So what techniques or what products that you will be referring me? So एक product से भी maybe a share is going in the revenue. So other than that, this is your actual revenue model, right? Because your application is free, which I understand.
right. So our application, the entire ML scan was free for a long time.
Yeah.
Now we have included subscription models for our patients as well.
Okay.
As you rightly mentioned, we were charging them separate for the oral care kit. We
Okay.
were charging separately for some treatment, right? Because
Right.
obviously they are going to our partner clinics, but we have all combined them in various subscription plans,
Yeah.
which they can buy, and they would get really good discounts for treatments, and without any break in the monthly supply of your kit, it would
Right.
be automatically there.
Right.
That's yeah.
So this, I'm not sure if I have heard a startup like this in abroad. So is it like first globally? I'm quite sure it is the first in India. But is there any other company which is doing such a thing in dental industry in abroad?
Well, there is one startup in Australia,
Okay.
and there is one more in the US
Okay.
who have the same idea of you clicking the photos of your oral cavity,
Right.
but the problem that they are trying to solve, the end problem, just because we have different problems in India, right? According to
Yes, yes.
geography, and they
Of
have
course, of
different,
course.
yeah, their strategy of taking it ahead after you've got the report
Yeah.
is different. Yeah.
Okay, sure. And there, abroad is mostly concerned about cosmetics and aesthetics. In India, oral cancer is one of the main reasons. Awareness is another. The basic कि कब बच्चों का दूध का दांत आता है प्रेगनेंसी में प्रेग्नेंट वुमेन को कैसे टेक केयर करना है देयर न्यूबॉर्न these are the basic at least in India for now. So
Exactly.
your future plans, like what your vision is and how you want to proceed ahead.
Right. When it comes to India, the vision is super simple but equally difficult to implement. Why? Because the kind
Right,
of challenges and the diversities that we have in single country.
right.
Right? Within India, we have four Indias. India
Yeah,
1.4, according to the customers' spending capacity, and there are a lot of factors.
right.
So, what I want to implement here is that even if you're devoid of, say, a physical dental surgeon in your area,
Yeah,
because 65% of our population still resides in tier 3 and below in
yeah,
villages, rural
yeah,
India. They have mobile phone, they have
yeah.
internet, so that
Right,
nobody should be devoid of oral care, the basic,
right.
everybody. So earlier the pyramid used to be food, shelter, are the basic things. Now I think the right education, good healthcare, and
Yeah,
sanitization are the
exactly.
new basics apart
Right,
from the earlier ones. So giving accessibility and affordability of oral care to all.
right.
Now, out of 1.4 billion population, we know the ratio who is getting an affordable and accessible oral health care. So that uh, in
Okay,
India, outside India, we have started expanding in UAE.
okay.
So very good response. The market is super mature. People
Right,
already know the importance of oral health, and they also know the impact it's making to their heart, brain, and in
right,
pregnancy. It was very
right.
good to know that. But again, when it comes to the ratio of dental surgeons to population there,
Yeah,
right? So if we are making some ways where the dentists are able to manage their patients smartly
right.
through our smart platforms that we have. And again,
Right.
patients get access to oral care whenever needed. Because we
Right.
know the condition which is happening in the UK, right?
Yeah.
They have to wait for a couple of weeks just to get an appointment, and then couple
Exactly.
of months for treatments.
Right.
So if we have this solution, it's accessible right away to them.
Right.
So both the
And
geographies have different
of,
problems, and
of
we are
course,
trying to solve. Yeah, that way.
yeah. So of course you can stay to dental, but in future you can include other specialities as well. And अगर India है तो do you have English के अलावा कोई और भी language in your application? हिंदी है उसमें?
Now, in the application, now we are integrating Hindi and Marathi to begin
Yeah.
with.
Right.
On our website, we have more than 10 languages,
Oh,
but we want
perfect.
to cover all 16 languages that we have in the country.
Yeah.
Yeah.
Okay. So, I was attending few government programs with the Delhi government, few entrepreneurship and business, and I was amazed to see that the government is doing so much for the businesses, startups, and entrepreneurs that we just don't know it yet. Like government is telling you कि कुछ करो, they are giving you money for the organizations to conduct programs for the awareness for people to actually come in special programs that are focused on women entrepreneurship. So
Correct.
I was really amazed to see that. So
Yeah.
what
I
do
would
you
just like
think? Yeah,
to add a point there that all the information is available out there on the internet. One request to all that you go through the website of G20 that we are hosting this year, right?
right,
And the first time that out of all the events that have happened in the past, that through our government, we have announced a new discussion or engagement named as Startup 20.
right.
Because other engagements like Climate 20, and there are a lot of discussions happening,
Yeah,
but Startup 20 is new, where again we have more added advantage. And under the section of Women 20,
right.
the change that we have got is from women centric startups to women led startups, right?
Exactly.
So a lot of policies are already present. It's just that
Right.
people are not aware of everything.
Exactly.
Go to the website and you can go through the details.
Yeah. So I want to mention, like, ask you, like, how dentists can work for dental those.
Multiple ways.
Okay.
Seriously, I mean, right from you won't believe we have 6 to 7 domains within dental those under which our dental surgeons are deployed and they are working.
Right.
Now, whichever domain that you want to select is according to your interest,
Right.
what your skills align with, and which
Exactly.
field you want to grow in. So we have
Okay.
both B2B, B2C operations. Within these
Right.
operations, then we have patient management, then the teleconsultation part. Within B2B, we have partner management and partner onboarding programs.
Right.
Within the content creation part, all the content is created by dental surgeons.
Yeah.
So, wonderful content creators like you, we can have
Yeah.
collaboration where we are creating video content, audio content like podcast, blogs together, right?
Right.
And the most critical and the core part is as the data annotators. So we are
Right.
training dental surgeons in our impact program about how, right from the basics of technical stuff to even advanced level of understanding these softwares and annotating them. So endless opportunities for dental surgeons.
They just have to go through your site, maybe email you or a fill a form. That's it, right?
That's it, yes.
Okay. So, have you not thought to, go in Shark Tank season 2?
So we were just going through all the categories that were
Right.
present, and sadly in this season there was no category which was covering core health tech as
Okay.
tech as an IP, right?
Right,
This
right.
season there was an infusion, wonderful season. Now we have
Yeah.
the finale going on, right? A lot
Yeah.
of infusion of D2C products, and it was good to see that a few of the brands from the oral care space were present.
Exactly. Right.
Wonderful. That is
Right.
creating education and awareness among the audience.
Right.
But
So this I want to
yeah. Hmm.
this a very important question like how you see India का future in business number one and जो लोग abroad भागते हैं immediately कि dentistry का बहुत अच्छा opportunity है abroad में I'm not saying कि abroad but I'm saying कि what you think about India in the next 25 years.
Hmm. Both 25 years, which is India at 100, right?
Right, right,
2047 vision hai, us being
Right,
from Indian economy, everybody is working. I mean, it's a very inclusive ecosystem which has been created now.
right,
So not just for dental, but for every industry, if you want to start something of your own or be associated, right? It's the
right.
golden period. When it comes to oral health, I believe next 10 years are the most important and the golden period ever in the era of dentistry. Why? Because
Exactly.
right now we are at a juncture of where the countries like in the US or UK went, especially यूएस, राइट, द रेवोल्यूशन विच दे हैड, हमें लगता था हम 10-15 साल पीछे, अभी जो नेक्स्ट 10 साल है, वी आर गोइंग टू रन एट अ स्पीड वेयर वी वांट टू overtake other countries also in terms of the
Right.
overall economy, right?
I guess we are on the fifth. We have surpassed Germany this time, I guess.
Correct. Now I think in the next 10 years the goal is to come third, and post 25 years, as we discussed, right, the
Right,
number one, 5
right,
trillion economy. So it's very
right,
exciting. You just need to be curious and be out there to give your 100%. Yeah.
right. So we were talking about skills. So I want to know ऐसी कोई skills which you really believe कि एक dental surgeon में होनी चाहिए if he or she wants to go into business.
um See, skill to go into business is not just limited to any dental surgeon.
Right,
Any personality that wants to go into certain business, start a startup of your own, or even be the decision maker within some startup.
right.
First thing I always keep saying is the curiosity. I mean, I'm
Yeah,
not sure why everybody's not talking about it. If you are
right,
curious about why things are working in a certain way and why not in that way, you will find a method to make it work more efficiently. If
right.
you come across any roadblocks where most of the founders give up, right, because trust me,
Yeah.
it's a very lonely journey, it's not easy,
It is, it is.
full of downs and a few ups, as I mentioned.
Yeah, yeah.
If you are curious, if your mind is open, then only you will be able to see the collaboration opportunities which are present, or some just different path which nobody ever thought of.
Right,
So
right.
curiosity, and then thinking with a calm mind,
Yeah,
and being persistent. I mean, really not giving up, having that
right.
hope every day, getting up every day and showing up there. Uh,
That
can
takes courage.
That takes courage, and it can make even impossible thing possible.
Exactly. You know, that waterfall we see, the stones are always round because of the water that has been through years and years made that Sharpie stone round.
Correct.
And you know, everybody, every dentist opens up a clinic. So there was interesting thing that you know the difference between entrepreneurs and innovation or business is just one word, that is innovation.
Correct.
Entrepreneurs and business is just innovation. So हम सारे लोग dental जितने भी surgeons हैं, they want to open up their practice, or all the doctors basically.
Hmm.
But that is starting up your own clinic, that is business, but that is not innovation yet. So that is not entrepreneurship. किसी ने clinic खोला, that is not entrepreneurship. But I believe, you know, we go through such intense training all the 5 years, and especially being dentist, हमने third year से patient करते हैं. That is something, अगर हमें right training मिले एक level पे, if some, you know, business and marketing basics sessions are included every month in dentistry, I guess we will like dental surgeon will be amazing businessmen or entrepreneurs.
Correct. Absolutely.
So
So you
yeah,
need to innovate, and to innovate, you need to be curious first.
right,
Second, I think even if you do some changes, some revolutionary changes, even in your dental practice,
yeah,
that's no less than being an entrepreneur.
right,
But just do not stick to what you've learned so far. Every day is a new day to learn.
exactly. And no matter even it is clinical dentistry, you know, we can never know everything.
Exactly. So you won't believe, in our impact program, we have kept aside 2 days to also expose you with all the clinical avenues which are present, in a way how can you more conservatively practice.
Right.
So right from biomimetics, which is again an upcoming topic of,
Really, yeah,
we have got a few speakers to enlighten you, and then if you want to do some workshops, you're free to go and do that. We are
yeah,
focusing more on non-clinical, but that does not mean that we are not covering clinical research and all the other
right,
aspects of dentistry. Yeah.
right. So, doctor, my questions are almost over. So, can you see any questions from the audience? Because I don't know how to open that.
No worries. Let me check if we have any. Top.
Like, how do we open that chat? I'm just afraid if I do something, my this live will be cancelled.
No worries. I'm just checking.
Okay, sure.
Uh, I think it shows me to open the browser, but again, I'm not sure if I open the browser, this screen
Okay.
should not. Yeah.
No problem. When this goes recorded, so जितने भी comments आएंगे, we will be answering that. It's
Yes.
fine. We
Yes.
will
Yes.
be
Absolutely.
active there.
Yeah.
Okay, so thank you so much. I wish you all the very best, and I'm so happy that it's an Indian company, and that has always been my focus. So I'm really, really, really glad, and thank you for all the efforts you are doing for dental dose. It's an amazing, and I'm quite sure it has a quite a future.
Thank you so much. I also thank you to for taking out this time having this wonderful conversation. I'm sure uh, uh, after this audience would have a lot of questions. We'll be answering them
Yeah,
on the comment section.
sure.
If they have any demand for us to have one more live and discuss on any
Right.
topic, I'm open for that. Yes.
Sure, sure. Anytime. So
Right.
thank you so much, Dr. Vidhi. It was so nice to meet you. So nice.
Same here. Thank you so much. Have a good
Thank
weekend.
you. Have same here. Bye. Same to you. Bye
Yeah.
bye.